Ascaris lumbricoides is our first example of nematoda. It's going to help you remember to wash your hands when we go through these examples of parasitic worms, because frequently their mode of transmission is through the oral fecal route. We get their infective eggs or larvae either on our hands or in our food. We ingest the infective stage, and that essentially continues the life cycle of the parasitic worm, and Ascaris is no exception. So it's typically a fecal source for the infective stage, typically an infective egg. Diagnosis usually occurs with Ascaris when the worm crawls out of a body orifice. In fact, it's not unusual for a person to be infected with parasitic worms and not even know that they're infected. Now here we see a photo of a single adult female Ascaris worm coiled up in the lid of a petri dish. Now this is a typically 100 millimeter sized
Petri dish is the regular normal sized lid of a petri dish, and you can see that this adult worm is looped around a couple of times. So that's a fairly lengthy worm, about the size of maybe a regular pencil in terms of length for a round-bodied Aschelminth.
Ascaris is the largest, most common nematode that parasitizes humans. Now, we'll find other types of parasitic worms that are even larger in length, but those are going to be classified in different groups. So for round-bodied nematodes, Ascaris lumbricoides is the largest round-bodied worm. In fact, the common name for Ascaris is the common roundworm, or just simply roundworm. If you have pets and you routinely give your pets parasiticides or some kind of chemical that would kill worms, or you deworm your pets, this is one of the types of worms that you would routinely try to eliminate or remove from your pet's intestinal tract with deworming medication. Now, there are people that sometimes routinely deworm their children. It's pretty rare, but probably a fairly beneficial activity. Not one that we do very commonly in the United States, but can be done. It's estimated that about 1 billion people, and those are not hard and fast numbers because there really aren't accurate reporting systems to tell us how many people are infected with Ascaris lumbricoides, but it's estimated that probably every 1 out of every 6 or 7 people has Ascaris. That doesn't include all the other kinds of parasitic worms that are available. Notice that the mouth part of this worm is a little bit different. Most of the time when we think of a mouth part or a mouth opening of an animal, we think of just simply 2 lips, a top and a bottom. But this one almost has a grasping 3-lipped structure or 3-part mouth that it can use to bring in fairly large quantities of food as it lives in the intestinal tract. It's estimated that a single adult female Ascaris lumbricoides can produce up to 200,000 eggs a day. These eggs can remain infective even after placed in preservative. So please be careful if you're working with an Ascaris that's been preserved in fixative for another class. Keep in mind that the eggs and the larvae inside the protective egg casing might still be infective. You can see the little example of the infected larvae in the left-hand photo, with the tiny little larvae coiled up inside. Here's the life cycle of Ascaris lumbricoides. What do we need to know from this life cycle? Well, we need to know and be able to identify the diagnostic stages and the infective stages. The diagnostic stage could simply be finding fertilized or unfertilized eggs in the soil or in a fecal sample. We could also find adult worms. And of course, finding the adult worms is very easy then to diagnose the problem. The infective stage would be ingesting a larval or immature worm that's still inside the egg casing that might be on contaminated vegetation or in sand or soil that's been contaminated with feces. Here are a few examples illustrating the size of adult Ascaris lumbricoides. When these are adult worms, there's no confusing them with anything else. The coiled up Ascaris example in the upper right-hand corner is, again, probably about 12 to 15 inches long, depending on, sort of estimating based on the little centimeter ruler that's in the photo. Each centimeter is roughly a half an inch long. So again, maybe about 30 centimeters, roughly 15 inches long. The image in the bottom
left-hand corner are male and female side by side to give you a better idea of how much larger the female is compared to the male, because the female has all the work of laying hundreds of thousands of eggs on a very regular basis. So her body size and mass must be more significant than the male's.
There's not much that will stop an adult Ascaris or even Ascaris larvae. They will migrate through tissue, but the only thing that will stop them is bone, and even that's often sometimes not a good stopping point. And in fact, the larvae can get into the bloodstream, migrate throughout the circulation, wind up in the lung, and migrate through into the lung tissue, causing hemorrhage and edema, and the typical symptoms that we'd associate with pneumonia. Pneumonia is just a clinical condition. It can be caused by all kinds of microorganisms or even chemicals or environmental sources like dirt or dust. And of course, this Ascaris pneumonia can be just as fatal as any other kind of pneumonia, particularly if it goes untreated or not correctly treated. When infected with multiple worms, Ascaris adults, because of their size, may lead to gastrointestinal blockage. They essentially fill up the passageway or the lumen of the intestinal tract. And of course, the adult Ascaris are notorious for not staying in the GI tract. They'll migrate throughout the intestine, through the intestinal wall, through the peritoneum, through liver, up large major blood vessels, migrating throughout the body, and have even been known to cause meningitis if the migration essentially extended from the intestinal tract all the way up through into the brain. Here's an example of a mass of Ascaris lumbricoides that was passed from the intestinal tract. At the bottom of the image is a 4 centimeter ruler. Remember, each centimeter is roughly a half an inch long. And so this, if you take the whole length, looks like it might be maybe about 10 centimeters long, which would mean roughly a 5-inch mass of adult tangled Ascaris lumbricoides. Ascaris on the move. Whether it's a larvae or an adult worm, not much can stop the large migrating worms, especially the adults. As we've mentioned a few times before, they can travel through blood vessels. It's not just blood vessels, but any other kind of ductwork or tubing, essentially on the inside of a body of a human or any other animal. These adult worms can essentially wind up blocking up bile ducts, pancreatic ducts, lymphatic ducts, as well as blood vessels. They can penetrate through any kind of soft tissue quite easily, and particularly when they pass from the intestinal tract through the peritoneal wall, dragging with them all the intestinal bacteria. It's not unusual for a patient to wind up with peritonitis due to bacterial infection because of the trail of intestinal bacteria that follows along with the helminth. Migration through any body system in the body is possible, including the central nervous system. Ascaris and anesthesia. Guess what just crawled out of the tracheotomy tube? As it turns out, Ascaris lumbricoides seems to be especially sensitive to general anesthesia. I'm not really sure why. Don't know if it's important at this point, but remember, most people don't realize that they're infected with worms. And so patients who undergo major surgery with general anesthesia might have their adult worms coming out or migrating out of the intestine through any body orifice that they can find. They'll migrate from the small intestine, through the stomach, out the patient's nose, mouth, or even tracheotomy tube. All of you that are going into healthcare that might wind up working in a recovery room,
beware of what you might see in that recovery room. Might not just be the patient.